Welcome back. We've been looking at COVID-19 figures in the country. In the last 24 hours, more than 13,000 cases were reported. This, of course, comes after the president announced that alert level 3 restrictions will continue. They'll be extended until the 15th of February. But now to look at whether or not there's been an improvement, at least in the last 7 days, we are joined by CSIR senior researcher, Dr. Ridhwaan Suliman. Ridhwaan, you were saying earlier on that of the 1,325,659 cases of coronavirus we now have in the country, there has been an improvement.
Indeed. Thank you, Tatisha. So what we're seeing over the last week is there's a decline in the number of daily new cases being reported. After reaching a high of 19,000, over the last 5 days, we've seen a sustained decrease. Currently at 15,900, so an 11% decrease compared to a week ago. And that's a promising sign. Of course, we also, as before, need to look at cases in combination with the testing and the test positivity measure, but the trend is promising.
So I want us to look now at the average daily COVID-19 cases.
Yes. So the number of cases currently, the 7-day average is at 15,900 per day, and that's a decline of 11% compared to a week ago. And also it's shown a sustained decrease over the last 5 days.
Okay, so the weekly and provincial figures?
If we break it out in weekly, we see that the Eastern Cape continues its slow decline. The Western Cape, after showing a bit of a plateau, has promisingly declined by 20% compared to a week ago. The good news, and probably surprisingly in a way, is the decline we're seeing in new confirmed cases in KwaZulu-Natal and Gauteng. KwaZulu-Natal decreasing by 23% compared to a week ago, and Gauteng decreasing by 12% to a week ago. So these are promising signs, and these are the bigger provinces that are driving what we see at the national level.
What would you attribute that to, Ridhwaan?
So if we try and understand what we're seeing now is a reflection of events that happened 2 weeks ago. Because of the nature of the virus, the incubation period and the lag from testing to reporting, it's events that happened 2 weeks ago. And if we look back, just over 2.5 weeks ago, we introduced the adjusted level 3 regulations. So it suggests that those are having an effect. Mobility data also confirms that people are complying. There's certainly a reduced movement amongst the public. Of course, there's also been greater public awareness of the risk, and that has altered behavior over the last few weeks. So I believe those are all factors that we're currently seeing now in the confirmed cases and the test positivity measure.
And I want us then now to drill down to the testing and talk to us about the importance of testing. As you mentioned, that there is a connection between the number of cases that we see and the reduction specifically, as in why it's important for people to test. What is it per week? Are we seeing more and more people testing?
Yeah, so if you look nationally, currently we're seeing that the number of daily new tests is just over 62,000, and that continues to increase since the end of the festive period, 5% higher than compared to a week ago. And this is good news. We need to test more widely, firstly, because we need to understand how widespread the infection is. Testing allows us to identify hotspot areas and to also pick up where there are resurgence levels, and also to pick up any super spreading events and cluster outbreaks. Of course, we also need to test to confirm any infections and positive cases so that people can isolate and people can prevent the further onward spread of the infection. So increased testing overall is a useful tool to combat the virus. And the increased testing that we're seeing over the last 2 weeks is positive.
And just looking at the test positivity rate that you were talking about earlier on, how important is it? Because especially those who are asymptomatic, who may suspect that they may have been in contact with someone, they'll say, well, I don't feel anything. Why is that important to have a record of that?
Well, it's most important for people to know whether they do have the virus, and so they can isolate and prevent further onward spread. And that's why testing is important. The test positivity measure allows us to quantify any increase or decrease in cases. Because of the high test positivity, cases are strongly influenced by the number of tests that we conduct. Currently, we're seeing that this test positivity measure has declined over the last week or so, currently at just over 25%. The trend is promising, although it would be remiss of me not to point out that the levels are still high. We're finding a positive case for every 4 tests conducted. And so we do need to continue driving this measure down towards more manageable levels and below the guidelines that the World Health Organization and the Health Department has put in place.
Ridhwaan, one of the signs, obviously, we look at to see just how bad it is, the situation is the hospitalizations, and we've been warned that there has been an incredible amount of those in the second wave and that the health system is buckling under pressure.
Indeed. So hospitalizations, well, in their own right, they're a very important indicator to track. We need to ensure that people get the best access to healthcare facilities so that ultimately we can save the most lives, and that is the mission. At the moment, we're seeing that the number of new hospital admissions continues to increase. The last week saw 13,200 new hospital admissions across the country, and that's a 5% increase compared to the previous week. The main driver, if we look at a provincial level, you see that the new admissions continue to increase in Gauteng, and also the smaller burden provinces such as Northwest, Mpumalanga, and Limpopo continue to see an increase. The good news is that there's a lower demand in Eastern Cape, and also the Western Cape has started to show a decrease in new hospital admissions. Also, the hospital admissions allow us to confirm the trend that we see in cases. This measure does follow the cases lag the cases by about 2 weeks. So hopefully with the decline in cases that we're currently seeing, we'll soon see a lower pressure on the hospital system in a week or two.
Ridhwaan, could that also possibly be as a result of a high number of deaths? Because we know that in some cases, for some people, unfortunately, they're not close enough to a hospital or medical institution, or some don't just make it.
Well, we are currently seeing very high level of death numbers being reported. Most of the COVID-19 reported deaths have occurred in a hospital. Of course, we also need to look at the excess death measure to understand the full extent of the pandemic, and both confirm that certainly we're seeing very high death numbers. This week, the current average of deaths per day is sitting at 575, which is unfortunately incredibly high, continues to increase and 10% higher than previous weeks. The good news, though, is that Eastern Cape and Western Cape are starting to show a leveling off of the number of new deaths reported following the decline in cases. Unfortunately, in KwaZulu-Natal, we're seeing very high death numbers being reported, 82% higher compared to a week ago, or doubling every 8 days. And in Gauteng, the number of new deaths, also above 100, has increased by over 50% compared to a week ago, or doubling every 11 days. We will unfortunately continue to see high number of deaths being reported. This measure does lag the cases trend by about 4 weeks. So unfortunately, this trend will continue.
I'm just curious about the lag that we were told to expect, Ridhwaan, including the excess deaths figures that you say could be higher. So if we're sitting at almost 37,000 number of deaths, if we look at excess deaths, how much of a percentage could they account for if we say the death toll is higher? And also, are we expecting to see the figures of cases increase due to holiday makers coming back and some of them coming back ill?
Well, we know that the excess death measures have indicated a very high number of deaths. The latest report showed over 83,000 deaths since the beginning of the pandemic in South Africa. It's difficult to attribute exactly how much of these excess deaths are COVID-19 specific. There are other factors, and we can't really disentangle all of the effects. due to the timing and the variation in the spread of the excess death measure, we do know that there's definitely a number of deaths that are within this excess death measure over and above the 37,000 reported COVID-19 deaths. Because we're seeing currently the number of cases showing a decline, just starting to show a decline, the death numbers lag that by about 4 weeks. So unfortunately, we probably have to wait another 3 to 4 weeks to see any effect on the death numbers and to see if this then goes down following the trend in cases.
Will it undermine the downward trend that we're seeing now, as in we probably are breathing a sigh of relief now, looking towards the 15th of February, patting ourselves on the back, saying we're doing good. But is it possible that after the 15th we can see an exponential rise?
Well, firstly, it's important that, and it would be remiss and neglectful for me not to point out that while seeing a slight dip in the number of cases, the level is incredibly high, meaning the risk remains high, and we need to remain vigilant. There always remains the risk of further outbreaks, and what we really don't want is to see the curve turn around and to see a resurgence. We really need to drive that numbers firstly down. Of course, if our behavior and any interventions that we put in place now, we'll see the effects 2 weeks later, and we need to continue monitoring any of the further outbreaks and clusters so that we don't have any resurgence. And that's the leading indicator in cases. The death numbers then will lag that by about 4 weeks, and that is ultimately the true toll of the pandemic. And we really need to monitor these quite widely as well.
Thank you so much for speaking to a senior researcher at the Council for Scientific and Industrial Research, Dr. Ridhwaan Suliman, saying that excess deaths could be as much as 83,000 since the start of COVID-19, but of course saying that it's very difficult to say how many of those are accountable or COVID-19 can account for.